COVID-19 hospitalizations passed an unfortunate milestone at Ballad Health hospitals today as cases surged through the region, now over 400. The number of COVID-19 patients in Ballad Health facilities tonight stands at 403. 92 of those patients are in intensive care units, 66 of them severe enough they are requiring the use of a ventilator to breathe. Today we have 7 pediatric COVID-19 patients getting treatment at the Niswonger Children's Hospital. Joining us now is Ballad Health Chief Medical Information Officer, Dr. Mark Wilkinson. Dr. Wilkinson, thank you very much for your time today. We appreciate it.
Thank you. It's good to be here.
Thank you. Let's first get your take on the numbers today. Over 400 hospitalized. This was what Ballad forecasted a couple of weeks ago. Are you expecting that number to go up, or are we seeing maybe a leveling off in cases? What do you think?
Well, the number is quite anticipate that we'll see a continued rise in those numbers. At this point in time, we're actually preparing for numbers above 500 inpatient COVID positive patients. We're hopeful that we won't get there, but we're skeptical. We think we'll achieve 500 inpatients, if not more, in the next week or two.
And your forecasts go out, I'm sure, beyond that. Are you thinking we could be approaching at that point? I mean, I'm trying to find the top here. Is that in sight, or are you not even at that point in your forecasting?
We've got some great people working with our data team and analyzing the numbers daily. And so we've forecast a high of over 500 inpatients. We're hopeful we won't reach that, but again, we're not feeling very confident that we won't hit that higher number in the near future. It's just that we've not seen this level of spread with the Alpha variant. Obviously, with this Delta variant now, it's quite contagious and spreads rapidly.
And it seems that results in more hospitalizations and unfortunately more deaths. Let's talk about what appears to be a new front opening up in the battle of COVID-19. Maybe not new, but certainly expanding in our area, and that's the monoclonal antibody treatment option. I understand Ballad Health has this week stood up a new place where people can come to get the treatments. What is it, and who needs to get it?
Yes, thank you. We have been providing monoclonal antibody infusions across our system for the past several months now, beginning with the Alpha variant several months ago, obviously, but it's not been as popular of a intervention as it has been most recently with the Delta variant. We have seen almost exponential growth in the number of patients receiving monoclonal antibody therapy. And just yesterday, we began a new clinic in Johnson City, which is open now and available for the infusion of monoclonal antibodies for those COVID positive patients that would benefit from that treatment.
Is this for anyone who's testing positive, or is there someone in particular who you would recommend aggressively pursue this type of treatment?
Of course, we're operating under the FDA's emergency use authorization regulations. So that means that people have to have high-risk conditions, which would qualify them for monoclonal antibody therapy. But those high-risk conditions could be as simple as an age greater than 65 years old or being overweight. Of course, those with chronic diseases such as lung disease or heart disease or diabetes or kidney disease also qualify for monoclonal antibody therapy at this point. Pregnant patients are in a population we're trying to make sure we treat appropriately with monoclonals timely so we can prevent those folks and their infants from being sick too.
What about age? Is there? We'd heard that even some pediatric cases were being recommended for monoclonal antibodies.
Yes, so we have the authorization again to go down to age 12 and up. So anybody over the age of 12 with similar conditions qualifies for monoclonal antibody therapy at this point.
You mentioned time is of the essence, that there is a period of effectiveness. What is that?
Generally speaking, we want to have patients receive that treatment if they're within 5 to 10 days of the diagnosis or the onset of symptoms. The sooner after the onset of symptoms or the diagnosis, the more likely they'll have full benefit of the monoclonal antibody. And so outside of 10 days from the onset of symptoms or 10 days from a positive diagnosis of COVID, that typically is the period of time we're not seeing much benefit in that antibody therapy.
Okay, and this is an infusion. This requires you to go someplace. Ballad Health, other places are offering it. You take it's put into your body just through an injection site. But we're hearing
That's
of
correct,
people
Josh.
who are coming, who are going, they're getting testing positive, they're in talks with their doctor, and they're not being recommended for this therapy. And so it seems that for some, they're going to have to take this on aggressively. What do you recommend to somebody who considers themselves to be at higher risk and tests positive? What do they need to do to get the treatment?
First and foremost, they need to, of course, be in touch with their primary care physician or other physicians that are present across the region, obviously, who can help direct them on the appropriate course of therapy for their COVID disease process. We've done, I think, a pretty good job of educating our medical staff across our healthcare system on the availability of monoclonal antibody therapy for their patients. We've also had our physician liaisons going out to primary care offices in our communities, also providing them with information on monoclonal antibody infusions, where we offer those across the system and how to access those treatment options for their patients. They can either put the orders in our electronic health record electronically, if they have access to that. If they don't have access to that, we provided paper orders that they can print off over the Ballad Health intranet website and fax those in to our communications center. Our Nurse Connect phone number is on there for faxing those in, and then Nurse Connect will take it from there and will schedule their patients to have the monoclonal antibody therapy administered.
Dr. Mark Wilkinson with Ballad Health, thank you very much for the latest on the antibody treatment facility and the latest from Ballad Health. We appreciate it very much.
It's my pleasure.